In the ALBATROSS trial, the hypothesis tested was that aldosterone blockade would prevent death, heart failure, cardiac arrhythmias in patients presenting with myocardial infarction. And we wanted to have an improvement of clinical outcome with this aldosterone blockade using generic drugs which have the cost of aspirin. So this is a randomized study, and we recruited patients with myocardial infarction, ST elevation or no ST elevation. We randomized these patients as early as possible, and these patients in general had no heart failure. This is very important, and this study really is different from the EFESUS study. And we randomized these patients sometimes in the ambulance for aldosterone blockade with spironolactone versus no aldosterone blockade. And we had a 6-month follow-up to look at clinical endpoints in these patients. The primary endpoint was a combination of deaths, resuscitated cardiac deaths, severe ventricular arrhythmias, need for a defibrillator, or heart failure. And this composite endpoint was not impacted by the strategy of aldosterone blockade. So the study is neutral on this endpoint, and is also neutral on all the secondary endpoints we had. What we see is a real trend which is not significant on mortality in the global population. And when we look at the most important subgroup, which is a group of patients with ST elevation myocardial infarction, representing 3/4 of the population, we have a significant reduction of mortality, going along with also numerical reductions in heart failure, in arrhythmias. So it looks like the STEMI population would be the preferred target for aldosterone blockade in this type of study. So we would like to redo a similar study, and that would be now in this type of patients. Aldosterone blockade is a very important therapeutic strategy in heart failure, including in heart failure occurring in patients with a prior MI. And we have all the data supporting these strategies. Now, for myocardial infarction without heart failure, I have to say it's not prime time for this type of strategy. We need more data, we need more studies. ALBATROSS is the largest experience, but it's still limited. With reminder, on ALBATROSS we have only 2 studies, and it's not enough to change our recommendations. So outside of heart failure, there is no room for now for aldosterone blockade.